A recent survey found that over 1/3 of Americans spend less than an hour per year reviewing their health benefit options.
Yeah, with the annual enrollment season upon us, now is the time to assess your coverage and find out which plan works best for you. So joining us now to discuss this is Chief Medical Officer at United Healthcare, employer and individual, Rhonda Randall. Thanks for joining us.
Thank you for having me.
Yeah, what are some of the things people should consider as this enrollment period gets underway?
Yeah, well, this is the time of year that millions of Americans need to make a decision around their health care coverage for next year. About half of the people in America get their coverage through an employer-sponsored plan. Your open enrollment period generally lasts 2 to 3 weeks, sometime between now and December, so watch for those communications from your employer. If you are a Medicare beneficiary, your annual open enrollment period begins on October the 15th and ends on December the 7th.
You know, this can be kind of an overwhelming process. There can be lots of different plans, terminology you might not be familiar with. You're looking for yourself and your family. Any tips and tricks to make this a little more manageable?
Yeah, you don't want to wait to the last minute. This is a big decision. It affects your health as well as your financial well-being. So you really want to get educated on the plans and choices available to you to make the best decision for you and your family. You may be very happy with the current coverage you have, but there might be a new plan available to you that has better coverage for your situation. So you want to take the time now to get educated.
Is it a good idea to try to find a professional who specializes in this type of planning?
You probably have resources available to you already through your employer. They generally have people on staff who can help cut through the confusion. And if you're a Medicare beneficiary, we also have some very nice things on our website to help you navigate through a lot of the terms and decisions. Our website is uhcopenenrollment.com, and that particular one for Medicare is called Medicare Made Clear.
Okay, you know, I think a lot of times the first thing people look at is what's the amount coming out of my paycheck every 2 weeks. But what are some of the other things that people should consider to make sure that your coverage is really comprehensive?
Yeah, you mentioned a couple of them. Those terms can be confusing. You want to know the difference between an HMO and a PPO. What's the difference between a premium and a deductible, or a copay and a coinsurance? So those terms are important. On our website, we have something called Just Plain Clear that helps walk through all of those terms. That's important. The next thing is to prevent those financial surprises. What is not included in your plan? Knowing whether or not your personal physician is on the network is very important. That can help keep your costs down substantially. And if you take prescription medications, you're going to want to look for that coverage as well.
Yeah, this is such a big topic for a lot of people. You pretty much advise people not to get overwhelmed by all of this, that there are resources available.
There are. And the best thing really is to give yourself time. So again, you may be very happy with the plan that you had last year, but it might have some changes associated with it. The medications can change, the network can change, your out-of-pocket costs can change. But every year there are often new plans that are offered to you that you want to look at as well. So this is really that time of year to look at what benefits are included: mental health coverage, specialty benefits like vision, dental, and hearing, wellness benefits that can help lower your costs or even give you incentives for making healthy choices like losing weight or stopping smoking.
Lots to keep an eye on. Rhonda Randall, Chief Medical Officer at United Healthcare, employer and individual. Thanks for joining us this morning.
Thank you. Be well.
And as Rhonda mentioned, they've got a lot of resources on their website as well. You can find links to United Healthcare to get you all figured out for this year's open enrollment on coin.com.